Hi, welcome to My Favorite Mistake. I'm your host, Mark Graban. Our guest today is Grace Bourke. She is Consulting Director of the Performance Excellence Practice at Baker Tilly. And Grace has nearly 40 years of experience in healthcare, quality improvement, and industrial engineering. She started her career in direct patient care and went to work internationally in biotech, supporting clinical research and global public health initiatives. Grace also played a key role in major technology implementations, including Kaiser Permanente's Epic rollout, and later she held leadership roles at Sutter Health. For the last 8 years, she's been an external quality improvement coach, specializing in tech-enabled improvement efforts. And on a more personal front, Grace also serves on the board of Corvallis Housing First, and partners with organizations focused on expanding access to care, including tribal health and PACE programs. She has an MBA, has taught at UC Berkeley, and brings a deep commitment to systems thinking and practical improvement. So, Grace, thank you so much for being here. How are you today?
Good. Thank you, Mark, for inviting me here. I'm looking forward to our conversation.
Yeah, me too. There are a lot of similarities in our backgrounds. They're not exactly the same, but we've done, I think, some similar work related to healthcare improvement. So we'll talk about that in the middle of the episode. But I'm not going to let you off the hook because as you're expecting here, the first question: what's your favorite mistake?
I think it's the one I'm going through right now. We had a house built starting in June of 2023, and it finished in May of 2024. But in March of this year, we found mold.
Oh,
And as we looked into it, we had a leak in our foundation into my walkout basement. That's also my office.
no.
So that was all quarantined, and we started to look into it. And then we had an inspector come out and found more issues. And
More mold or different
then we had a civil
problem?
engineer, more problems,
Yeah.
code violations like no smoke detector. I'm trying to think some of the other ones, just a lot of, actually it was a 64-page report with pictures.
Yikes.
And the inspector was shocked. He recommended engineers. So we got a civil engineer and a structural engineer. And I got to learn a lot about engineers.
Mhm.
Very focused, very specific. They found significant defects in the foundation. Water is leaking in under almost all of the foundation because we're on a little bit of a slope to have a basement. And in fact, the geotech engineer and the structural engineer came out yesterday to do some testing. And I'm waiting for the reports on how bad is it? Because every time somebody comes out, they find something else wrong with the house. So it's been quite an adventure.
So, I mean, I want to dig more into that. I'm sorry to hear all of that. Hopefully, I mean, is it why? So, I mean, that just sounds like an awful thing to go through. Would you say the mistake was choosing this particular builder, or like, I'm curious why all that inspection wasn't done before you took possession and closed and moved in? Not to blame you for that, but I'm wondering why.
Yeah. Well, so you know the expression we use, trust and verify?
Yeah.
Yeah. I'm very high on trust, and I did not do enough verify.
Mm.
I trusted the bank's inspections. I trusted the city's inspections. I trusted what the builder was saying, and I didn't show up and trust enough. Of course, we built it long distance, so that added to some of it. And the other part is full transparency. I didn't listen to myself enough.
Mm.
Working in healthcare and process improvement, I know enough about how things should work. And I kept saying, we need to be up there more. We need to be up there more. And I got vetoed. And I regret that I didn't speak up more for what I knew was right.
Yeah.
And I think that happens a lot in healthcare. We don't feel safe it's not psychologically safe to speak up. And it's not just at work, it's in our lives.
Mm-hmm.
And I didn't speak up enough. Sorry, go
Yeah.
ahead.
Yeah. So you're still working through, I mean, like I hope there's, or, we always try to look for the positive in what makes this a favorite mistake. Is it a favorite because it's caused you to reflect on these different things, or what would you say?
I think it helped me learn a little bit about myself and to have a little bit more backbone. It's one
Mhm.
thing when I go into work and I know I'm the expert, but again, it's the imposter syndrome. It's like, oh, I don't really know that much. I shouldn't speak up, things like that.
Mhm.
So I'm addressing the feelings of imposter syndrome. And I'm also putting things in perspective. One of the vendors that came out reminded us it's just stuff and stuff can be fixed. So I'm just breaking it down into the process steps and working through it, asking for help and doing more thinking.
Mhm.
So we're actually going to make some improvements while we're tearing apart things.
Yeah.
The structural engineer found out our stairs are not safe and they're going to
Oh,
have to be torn out.
oh
And so it's
my.
like, okay, well, if we're tearing down the outside stairs that block my picture window, we're going to move them to the other side.
Yeah.
Find the silver lining. That's what I'm doing.
Well, yeah, and that imagine that can I mean that can be hard to do. Yeah, I mean you say the house is just stuff and it contains our just stuff. I mean a house is the most expensive stuff we
Ooh,
ever buy or build.
yes.
Right? I mean, so I mean,
It's my,
I might get
yeah.
upset if somebody said regarding it. It's one thing to say like, oh, someday I'm going to drop an iPhone and shatter the screen. I have dropped my iPhone a lot over 15 years. I have never cracked or shattered a screen. And again, it's a matter of when. I'm surprised it hasn't happened yet. But I have Apple Care, and a house has insurance, I might be more likely to say, well, the phone is just stuff, but it's not. It's only mildly expensive, not house expensive.
Ah, that is a really good point that I'm probably a little bit in denial about. It is a big ticket item.
I'm not trying to make you upset about it, or
Yeah, no,
it's you.
no, no. Um, Fortunately, I have a brother who's in project management for construction, and he keeps saying, oh, this is something the builder is responsible for. Um, on the other hand, I have my husband saying he's not going to pay for this. But the builder has acted with integrity
Hmm.
and says that he will fix it. I'm going to be honest. The problem is he does bad patches on top of shoddy workmanship.
Mm,
So I guess I'm feeling like, okay, this is a challenge. I'm going to make this right. I can do this.
yeah. And I think of you're making me think about different situations I've been in. Um, my wife and I have moved a lot, in the last 25 years. And, in buying a home, there's always an inspection and you hire a specialist and there's a report. I don't know enough to know if the inspection is good. Like I don't know what, if anything, I should be second guessing. And there's almost always something that got missed or something that was deemed okay that turned out to not be okay. So like to your idea of trust but verify, it can be hard to verify whether it's a home or like, I mean, we're going to maybe move back and forth to the parallels to healthcare. If a surgeon is proposing surgery, which I've had happen before, let's say related to a back issue, I could trust or I could verify, which means maybe getting a second opinion. It's hard to evaluate these technical things, whether it's electrical work or potential back surgery.
And I'm going to be honest, in healthcare, in my experience, getting a second opinion is not easy. Docs don't want to second guess another doc, etc. And my husband's facing back surgery, and his doc said, feel free to get a second opinion. And I'm thinking, it took a year to get in to see
Yeah,
you.
yeah. And what's the
Um,
tone of voice that was used of, it could sound like a sincere,
oh
hey,
no. Oh,
to get a second opinion or in a back, well, if you have to, I mean, you can delay your surgery, get a second opinion. Right?
I think part of it is, and so I do a lot of technology implementations because I love that.
Yeah.
I'll be honest, I do love adventures and a challenge. And it's probably what got me into the mess with building a house from scratch.
Uh-huh.
you have to get educated.
Mm.
And that can be a challenge in this day and age, but life is so complicated. This is not the old days with the country doc that you paid them with a chicken or eggs. This is bigger risk, bigger financial impact.
That too.
You know, especially with some of the health plans that are out there now, where we're on the hook for a significant amount of money.
Might be the second most expensive thing you buy other than a house.
It's been ages, decades, but a statistic or a saying that stuck in my head, it was from IHI and Brent James of Intermountain Healthcare.
And sorry to interrupt, but for those who don't know, IHI is the Institute for Healthcare Improvement, which is a great nonprofit organization
with a big mission to help healthcare. And they have some big data sets and they do a lot of research. The statistics, the number that stuck with me is we're one of the few countries, one of the few first world countries, for lack of a better word, that bankrupts their citizens over healthcare.
Right. That is a uniquely American
phenomenon.
Other countries have other problems with their health systems, but you're right.
Yes. So to your point, you're absolutely right. Healthcare, especially back surgery, which is high risk, expensive, neurosurgeons, recuperation, rehab, and expense. It's a big investment.
Mm-hmm.
And it's hard to get educated. Just healthcare literacy. I find myself translating for my family members on healthcare literacy because healthcare uses a lot of technical terms that are very specific definitions, and the average person doesn't know what they're talking about.
Well, there's Latin terms. I ran across that as an engineer getting into healthcare 20 years ago. Like, that patient's NPO.
I remember that. Yeah.
What does MPO mean? It means like nothing by mouth. I'm like, nothing by mouth doesn't. That MP. Oh, well, it's based on the Latin. I'm like, why?
Yep.
Okay, but why?
When I was in high school, I actually took 2 years of Latin because I knew I wanted to go into healthcare. Yeah. And I figured 2 years of Latin would help me with all the terminology in medicine because it is very, very Latin.
Yeah.
So back to the whole thing about how do we get educated? How trust and verify. How do we verify? We have to get educated. And in healthcare, even in construction, we kept having arguments with the builder because he said, you're not using the right term. It's like, well, you're not using the same term. I don't know what your term means. And then my brother uses different terms. And so it can be quite challenging to get educated. But I think it's worth the time investment up front. And I missed that step.
Yeah. And I think there's a lot of mistakes people hopefully don't repeat. So like, we've moved into, a number of condo buildings, and there's always a condo association, an HOA. And the first time we moved into one, we didn't know anything about the questions we should have asked about HOA finances, and it was still developer controlled because it was a new building. And like, we shoulda, coulda done that research in advance, but we're both busy professionals and we do our best to understand how mortgages work. We'd already bought other previous homes, and sometimes people, thankfully we've avoided a really bad decision, but somebody out there listening has a story of like, oh yeah, we bought a place and the HOA was a disaster and we ended up getting socked with a big bill the first year we were there. And now we've learned, and my wife and I do this, we ask, like, let us see the financial report. How much cash is on hand? Have there been special assessments? And sometimes we learn those mistakes the hard way. Sometimes people, I guess, learn from someone else or do that research. But there's so many things we might not know.
Yeah. And, it's a really good point. How do we get educated? Because we don't know what we don't know. So how do we educate ourselves? We helped our daughter buy a condo, and 3 years into it, there's a $3 to $6 million home HOA encumbrance for they're near the waterfront, and they have to do a massive pier support to prevent prevent the land from sliding into the river.
And people in Florida are faced with a lot of
Oh,
big
hurricane.
big bills, either because of
Yeah.
hurricanes. There was that one awful collapse, tragic collapse
Yes.
with the structural issues that everybody's now having to inspect for, and it's hard to get insurance. But I'm thinking, back to the medical side of things. I brought up the lower back issue because that was very much mine at the beginning of the year 2020. I was in the emergency room New Year's
Oh,
Day with awful back pain. I had a badly herniated disc and all of this
oh.
pain and was in the ER. And I wrongly thought on January 2nd, this year's only going to get better from here. And then COVID.
There's that optimism.
I was being optimistic, but the first spine specialist I went to recommended surgery and kind of scared me. And like, if you don't have surgery right away, your foot's going to be numb the rest of
Oh,
your life. And you know how
oh.
this is as a traveling consultant, though. He said, well, if you have surgery, you won't be able to fly for 6 weeks. I'm like, okay, well, then I need to have the surgery in Orlando because I need to be there where my wife's working if I can't travel for 6 weeks. So I went to a doctor in Orlando, not looking to get a different second opinion, but it was a practical matter of I needed a surgeon in Orlando. And wouldn't you know, that surgeon independently said, I think in the journals, and he gave me the journal articles, that the medical evidence actually shows recovery and outcomes are better not having surgery than having surgery. Now, he was a younger doc with, I think, some more recent training. And then
Yeah.
I wasn't about to go follow up with the doctor back in Dallas and say, hey, by the way, young punk doctor has this journal article. Do you want me to send it to you? Like, I wasn't mad at that surgeon, but from his truth was that surgery was a good idea. And this other doctor's truth was that no, you should let the body heal itself. And he could have gotten paid for doing surgery, I bet.
Yep. And that's one of the things. And I'll tell you, I've run into that too. I fractured my spine. And it turned out I had osteoporosis secondary to a healthcare treatment. And so my primary care doc did this certain protocol. And I'm going, this is not working. This is not working. So there was a website I used when I was a RN case manager.
Mm-hmm.
Even though I wasn't an RN, I could do the work because my background is more technical, just no bedside manner.
Yeah.
So I went to this specific for healthcare providers. What's the latest on the research? And it's like, oh my gosh, we're doing a 15-year-old protocol. I want the new protocol.
Mm-hmm.
So I went to him and said, hey, this is what we need to be doing. And he goes, well, I can't order that. I said, well, get me to who can order it.
Yeah.
And so ended up going to an endocrinologist who I didn't know was the specialist for osteoporosis.
Mm-hmm.
And so not even the docs know all the information they need to know. And it's evolving so fast.
That's the thing. Yeah.
How do you stay up with the latest? And I'll tell you, looking up YouTube videos is, like you can do to fix your phone, or the Keurig got broken. Mm-hmm. So my husband did a bunch of YouTube videos. You can't do that for healthcare. Mm. So that is a really big challenge I don't think I have an answer for. How do you get yourself educated?
And, there's this phrase, and it's politically loaded, but especially over the last 5 years, people say, do your own research. Well, I'm probably, like, if I'm researching a washing machine that's on the fritz, just to pick an example, that's not directly happening, but I might find different opinions about whether you should repair or replace the washer, but I'm probably not going to run across, let's say, misinformation or disinformation.
Yes.
And that happens in the realm of healthcare.
There is. And one of my pet peeves, it's funny because I'm running into it with like friends and family. And one friend said, oh, I had a back injury and they did a cortisone shot and it didn't work for me. So don't do it. I was like, you're just one data point.
That's true.
And you don't know what your back injury is compared to my husband's back injury.
Mm-hmm.
You have no expertise, and you think that just because you did one, you're an expert.
Right.
I took a machining class once, and the teacher said, if you want to learn a new skill, go out, look at YouTube, find 3 videos, and find the middle ground, because they're not going to agree.
Uh-huh.
But how do you do that with 3 docs, right? Find 3 docs, get 3 opinions, and pick the one that you think is the most,
Or
the 2 agree.
2 out of 3 vote. I mean,
Yeah, what do you take a vote?
yeah, and I mean, this back to back to the trust but verify question. I mean, I think of one other case of mine. This is going back 20 years ago. Thanks to hereditary, I have some pretty bad varicose veins in my legs.
Oh,
Thanks, Mom. So did she. And it wasn't just, kind of unsightly, but like really achy. My legs were really heavy. It was like a medical issue, not just a cosmetic issue. And so I went to a vascular specialist and he proposed a particular procedure. And thankfully, we had a friend, and we know, like, oh, she's a nurse in a vascular clinic in Nebraska in a different state. And we called and we asked and got her on the phone. And I was explaining what this doctor was proposing, that there would be a big incision in each leg from groin to ankle. And you're making, for those listening to the audio podcast, can't see Grace's eyes getting wide. Well, our friend, because it was on the phone, I mean, she shrieked, she yelped out loud of like, that's an archaic procedure. Don't let them. And if we hadn't had that person in our life, and I found another doctor that was like, no, actually, no. We can do a much more minimally invasive, like 4 little incisions, and the healing will be better, and the pain and the I'm not trying to now. It makes I'm not. I don't think anyone's accusing me of being ageist, but that thought popped in my head. I don't think it's just a function of age, but I think it's back to your point, Grace, about it's hard to keep up with everything. And if you're a surgeon who is good at a procedure, why jump to the new learning curve of a different procedure? There's that question too, right? I mean, these are tough questions.
So years ago, I was implementing electronic ICU at Sutter, and we decided to tackle or to align with the Surviving Sepsis campaign, which is a campaign to prevent unnecessary deaths from unrecognized and untreated sepsis, particularly 2 sources: hospital-acquired infections, but also 50% of them were community-acquired. But as we were writing up our research paper for publication, we found a statistic, which is it takes 17 years from when something has been fully researched and validated to be the best practice in healthcare, 17 years before it becomes routine practice.
And that number goes back a very long time, and it seems to also hold true today.
Oh my gosh. So how does a doc, I mean, first of all, it's not even filtering into the providers. There's so much change. There's another quote about how many hours a doc would have to spend reading journals to stay up. And I think it's more hours than a human being can stay awake.
So maybe AI can help there?
That's an
summarize
interesting
and say, here's what you should be reading or summarizing. I mean, I don't know. I'm brainstorming.
That's a good point.
I'm jumping to a solution. I expect you to scold me for that,
okay,
Grace.
No, yes, it's somewhat of a solution, but it's more of an approach. So that is actually something I did on the construction. So as I mentioned, our foundation leaks, and it's a huge foundation because it's a walkout basement. So I did do an AI search and said, okay, what are the things that you do for sealing basements, and give me the references. And then I go back to the original ones. And if that reference is a vendor, I might give it a little bit more weight than I do just a contractor who says, hey, this is the way I think you should do it. And then the other thing is if there's any institutions that have information, that type of thing. And frankly, I talk to experts. Oh my gosh, I have gotten to know so many engineers. But how do you get an expert equivalent to an engineer for healthcare? I mean, these people come in and they spend hours and they come with a big price tag.
Yeah.
I think, part of it is, I guess I'd love to see us do, healthcare does it a little bit. If you have cancer, they will give you an RN case manager who is an expert who can help you navigate.
Yeah.
They are specialists in that field. There are abdullahs for when women are delivering babies during the pregnancy and delivering. But how do we get, so it's starting to get advocates, and then AI can be a way to get informed.
Yeah. And this is in aspects of life that are more important than just stuff. This is our
Yes.
lives. This is the lives of others. And so, maybe as I'm thinking through this, like maybe the amount of research we should do depends on the stakes and what happens if something goes wrong. So I wanted to ask you, like, to the house before we bounce back into healthcare, like what outcome are you hoping for with the house? Like things can be repaired, things can be made
Yes.
right, as opposed to some medical errors that have debilitated or killed somebody.
Yeah, let's start with the easy one, the stuff that can be fixed.
Yeah,
So I'm hoping, I'm building a very specific list for a statement of work. These are the things that need to be fixed. I have to go through all the engineering reports, the inspector reports, and pull out the very specific things. So I think that for me, that phrase of trust and verify becomes trust and vigilant, educated verification,
sure.
because that has increased. It's like a video game. We got to keep leveling up. And I'm sorry, we got to keep leveling up just in life, because it's getting so much more complicated.
Mm-hmm.
So ask me that question again for healthcare.
So
Oh,
I'm thinking, like, in
now I remember.
healthcare, there are some situations we might get ourselves into. Let's say a surgery that wouldn't generally be indicated, or some approach to prenatal care or delivery that led to a catastrophic problem that could not be made right. I mean, but people are busy and these things are complicated. So as I'll leave some space for you to share your thoughts. But as I'm thinking through this, sorry, thinking like, well, if the stakes are high, but it's also super complicated, that's still a big challenge.
So that goes back to the Institute for Healthcare Improvement, the 100,000 lives. I didn't realize that's 20 years old,
That
2000.
campaign, yeah.
That campaign. I don't think we've done that much better. And so for folks, the 100,000 Lives campaign they did a study, and they found that each year healthcare killed, not injured, killed
Mm-hmm.
100,000 people from healthcare mistakes, not things that we couldn't treat or we didn't know how to treat or
Right.
they couldn't get access to care, but actual healthcare mistakes. And this is always a challenge in healthcare because we tend to have big egos. We've been highly educated. We're an elite group. We're prima donnas. Healthcare,
Well,
major snobbery. They didn't want to admit that they make mistakes. And that's 100,000 people that died unnecessarily.
yeah.
And in 2 decades, we might not have done any better. So there is no obvious, easy answer.
Mm-hmm.
I think the first step is we have to admit that,
Yes.
that there is a problem. We have to admit we're part of it.
Mm-hmm.
And we have to commit that we want to be a part of the solution. And I'm going to be honest, Mark, I work in healthcare consulting, first within Sutter and then externally. We're having trouble getting executives and leadership to admit that it's not okay to make a patient wait 6 months for an appointment. You've got to fix your processes.
Right.
It's not okay to harm people. And it's not okay to kill people unnecessarily because mistakes happen. And nobody wants to go to work to make a mistake.
Right.
But the systems are broken. And people are doing their best. Look at all the people we had check out of healthcare because they just got burned out by bad systems.
Right.
And
overburden and stresses that are also
stressed,
solvable stresses.
Think about it. You make a mistake at work or it's just been bad communication, right? You go home and you have a bad day. You don't get over it just because you left the office or left the hospital or the clinic or whatever. And you go back and you do your very best again, and the same things break, and you get your same heart weariness. It
Yeah.
just wears on you.
Yeah.
And we don't respect people enough in healthcare. We don't respect the workers, and we don't respect the patients, and we don't fix the systems. Healthcare's really broken. And now the financial impact is going to be even worse. And we've got to get leadership to realize this is their responsibility. The system is their responsibility.
Yeah.
And how do they support people and coach them and invest that time and yet get out of the way?
I totally agree, I think, with everything you said there. And you make me think of, the idea, we talk about that on this podcast a lot. You have to first be able to admit a mistake and feel safe to admit a mistake if we're going to go into learning and prevention and improvement mode. Admitting a problem is often the first step. And in hearing you use that language about, this many people are killed, or that healthcare problems kill this many patients. I got scolded once 15 plus years ago for saying some of those exact same things by one of my bosses, not by somebody at a hospital client, but I got scolded about, oh, you can't talk that way. And my, engineer brain says, but this is true. It's an accurate thing to say. If we're going to dance around being so afraid to state the problem clearly, what hope do we have of solving it?
So I think I have the advantage because I started in healthcare and then went into industrial engineering and technology and all of that. So I recognize that culture, but I'm with you. You've got to say, I want things to be better. And if you're not willing to do that, but I think it takes three things. And this is my personal approach to change. Connect with the head, engage the heart, and enable the hands.
Wow.
So the head is all about the facts, the numbers, 100,000 lives. That's the numbers. Or it takes 6 months for a new patient to get in to see a primary care provider. You also have to tell the stories and connect with the heart. Why is this bad? Because this is somebody's grandmother who didn't come home, who didn't see her grandchild graduate from high school. That's why we need to fix the 100,000, the 100,000 lives campaign.
Right.
Then you need to enable the hands. What are we going to do to fix this? How can we fix it? What is our role? Let's be clear. Healthcare is a mega machine right now. And it is not something that can be fixed by one person trying to do better in their clinic. Yes, they should do that. But we need some bigger systems thinking and advocates and work done and connections we need to have this collaboration between policy setting from the government, which includes funding policies, and the insurance companies and healthcare providers. And I don't quite know, maybe we need AMA to step up. Maybe we need, I don't know. Right now, I don't see a solution, but I know it needs to be better. And I have hope that things could be better. But sometimes I think I'm overly optimistic about where healthcare's going.
Yeah.
But I show up every day doing my best.
I know. I mean, this is powerful, what you're saying there. But now I'm going to bounce back and forth again. We're making these parallels, I think, between, let's say, home building and a surgical procedure. Did the home builder apologize? Were they super defensive in making, I mean, like how, because the way we respond after a mistake matters a lot in either setting. What happened? What's happening with your home?
So the builder has a lot of hubris. So some of it he just brushed off. And he lectured us for 2 hours at the first on-site meeting after the inspectors.
I would have not tolerated that personally.
I think he talked 90%. His son, who I think was actually the foreman, who was brand new with this, and untrained, unsupported. And that's, I think, one of our biggest things we have to fix in healthcare.
Yes.
We hire people and we say, we see you have potential and here's this job. And then we just smack them with overloaded work
Yeah.
and we don't develop our people. And that is every leader's responsibility. I don't care if you're at what level.
Yeah.
So Builder talked 90%, his son talked 5%, and we got to talk 5%. He went through the list and said, yeah, I'm going to fix this. I'm going to fix this. He never took notes.
So
And
you're developing this list now.
Yes, because I can't trust him to do it. But more than that, his fixes are bad patches.
Yeah.
Literally, he dug a hole through our foundation to the dirt outside and then did a little trough to let it drain across, down, and evaporate within the house. Oh, the favorite one.
Is that just moving the mold from here to there?
So we're on a slope, and they did geotech before the developer even started moving the dirt, before they built the lots. And I love our house, and I love the location because we back up to a nature preserve that backs up to wetlands.
Mm-hmm.
As soon as you hear wetlands, okay, that hill is wet. It's constantly wet. And so he put in a retaining wall and he cut a notch in it and he put a rebar that drains into a 5-gallon paint bucket. And that's his fix for moisture leaking under the house. So there's this trust and verify. And then there's also a call them out on their bad behavior.
Yeah.
I worked with an ER nurse and she would just, she went into consulting and she was my buddy for a lot of internal work, et cetera. And she'd say, oh, I'm going to call them on their bad behavior. Mm-hmm. So respect and call out. This is not acceptable.
Yeah.
I know. Yeah. And so that's why I brought in the engineers. So I'm going to get the expertise help. But you're right. The attitude matters so much. And I did learn. I am not going to have him over to the house to talk with us. I'm going to do it via Zoom.
Yeah.
And I'm going to have a transcript.
Yeah. Yeah.
So record keeping, documentation. Yeah. I'm going to help him. This is an amazing opportunity for him because if he actually engages, he can level up on his skills.
But
he could. It's his choice.
But see, and this sounds exactly like healthcare. We could copy and paste a lot of the same discussion, a few words, and it's back to being the healthcare discussion of like, well, why are we going to repeat the same mistakes over and over again? That doesn't have to happen. We can learn and improve, but I'm like, does the home builder have to? If they're super profitable and getting a lot of customers anyway? Like, I'm going to tell like the very short version of the one attempt about 10 years ago. My wife and I it's not custom home, which it sounded like maybe your situation was, but we went under contract to buy a home that was being built. So basically a spec home with a couple of options.
Okay.
But we, in the spirit of trust and verify, we started seeing all kinds of glaring, obvious mistakes they were making. And that got us really worried about all of the things we wouldn't know or be able to see. And so it got to the point where we were trying to back out of the contract because we had just lost all faith in them. And like one of the final blows, I have the text messages still with the sales rep of the complaints from me and blah, blah, blah. And he wrote back and he said, well, I've worked for 2 different home builders and I'll tell you, there's mistakes like this made in every house ever built. And I wrote back and I have the screenshot still. I'm like, is that supposed to help?
So what part of that is okay? Right?
I mean, why would you even say that if that was true? Why would, what? So we asked for our money back and they said no. And we figured it was less costly to walk away and buy an existing house with fewer problems. But, and that was not a mistake to walk away from that deal. I could do a solo episode on that story someday, but the hubris. How is that okay? And how does that not make it more expensive to build a home? And how does that not hurt your margins? And it's crazy.
Well, I think he's going to start picking clients that aren't going to hold him, that don't hold him accountable,
That's
because
another way to handle
that
it.
accountability doesn't fit with the hubris.
Mm,
Honestly, I don't think he's going to change. And my husband wants to change him a lot and keeps asking, well, why did he do this? And why did he do that? It's
yeah.
like, you know what? That's not my problem to solve. My problem to solve is this punch list of defects. And I'm going to be honest, I have 15 pages of notes. My brother and I went through one of the engineering reports. Poor guy, he comes out here on vacation. What did we do? Nothing. It's a busman holiday. We went nothing, geotech engineers on site going through all the reports, all this. And just from the builder's response to the report was 30 line items.
Hmm.
And I'm going to have to do my own project planning. And I guess the thing is I have to step up a lot more than I thought. And I think that's part of it. For patients, we all have to step up more. We have to ask questions. We're going to have to do research. We're going to have to find an advocate or ask for help. And healthcare will not make it easy. My builder has the same hubris that I see with the people I work with. And maybe that's part of why this is my favorite mistake, because this
Yeah.
control is small enough, I can actually make a difference on this.
On this
Whereas
house,
on this house,
not on this builder.
not on the builder, but it's like they talk about world peace. You can't solve world peace,
Yeah.
or world hunger. But there are people that have done no kid going hungry at that school district. And they even found to do lunches during summer. So we can't solve world peace, but what peace, world hunger, but what peace can we solve? So I can't fix the builder, but I can fix the foundation for this house. And I can improve myself along the way.
Yeah.
I can level up.
Yeah. So, Grace, I mean, I want to maybe there's one other thing I want to cover before we wrap up here. One thing I'm going to suggest, we could talk about these topics, and there's so much more I would love to dive into with you about in healthcare, preventing mistakes, reacting to mistakes and learning from them. And maybe, down the road, maybe let's do a second episode where you can tell us the resolution of what happened with your home, and we can also explore some of these other
some
things.
improvements in healthcare, because I do see
And-
progress. I'd love to share some of the things the positives in healthcare.
Yeah. So let's okay. So it sounds like that's a yes. We can do that at some point. It
Yes.
might take a while depending on how this house adventure is going. But so speaking of adventures, I know you wanted to talk about, and I thought this would be interesting to discuss when it comes to, learning through mistakes, and as you put it, the mistake you're planning. Tell us about that.
So just a little background for listeners. Mark asked, the topic of this is your favorite mistake. And my answer was, well, I have two, the house and the one I'm planning. I do glass fusing as a hobby, and it is quite technical and touchy. You can do everything right and still the piece shatters. But what I love is when I first set up the experiment and I think about, okay, what do I want to make? What do I want to accomplish? And I actually have a form, and it's standard in the industry for people that do this as artwork or even professionally, that you decide what you're going to do, and then you do it, and then you look at it, and then you learn. And it's a PDCA, just like I do at work. I do it at home.
And I'm sorry, I'm going to jump in with the jargon. Sorry,
yes, plan, do, check, adjust.
Yes.
Yes. So I do a plan.
Yeah.
And that is, okay, I did this with my great niece and nephew who are 9 and 11, and they wanted to make glass hearts. I said, okay. So I let them pick the glass and we put it in the molds, and then I have a firing schedule, and then I have to look and say, okay, how did it go? And it's like, you know what? I got that one nailed, but I want to push my creativity. So for my daughter, she wanted a hobbit house for her yard, little decorative. It's like, how can I make that out of glass? So I start pushing the envelope constantly. That's the mistake I'm always planning. And that's why I think hobbies are so great for learning to learn. You push yourself. Okay. Quilters, they come up, they do a basic one and then they do a slightly more advanced and slightly more advanced. And then they get to be expert quilters, or people that even just go to the gym and work out and say, okay, I want to get in shape, or people that say, I want to run a marathon. So I encourage everybody to have a hobby. It's a place where it can be psychologically safe to make mistakes. It can actually even be funny and fun.
Mm.
And it makes it okay to learn. And then that can go back to work, and you can actually realize this is the biggest thing that hurts my heart when I consult, when people feel trapped in a broken system.
Right.
And I think that as people tell me I have pixie dust, and that's the hope and the realization that they're not stuck in a broken process.
Mm-hmm.
They can do some things. And that's why I like hobbies, because we learn to do that and then we can take it back to work and just realize there are small changes we can make that will make a difference.
Yeah. Yeah. This idea of learning how to learn, learning how to improve in relatively small stakes settings. If you make a mistake with like a little bit of glass is not that expensive, or can you melt it and reuse it? Or I don't know anything about this process here. I mean,
so I just did a piece. Yeah, I did the Hobbit house for my daughter, and it was great. I loved it. It's like, ooh, I want one. I opened the kiln yesterday morning. It shattered. I was like, oh, why did that happen? And I knew I was pushing the envelope. There were some things that, you're not supposed to do, but you can kind of sometimes make them work. Yeah, well, I didn't quite do all the things exactly right. And sometimes, and there's a Facebook groups for different things where people share their mistakes and ask, hey, you guys, what happened? And there's a very specific way of sharing within that community. How did you do? What was your do?
Yeah.
What was your plan? What did you do? And then your check.
Yeah.
And they get a group learning. But I did open the kiln and the piece was shattered. And I could probably remelt it, but I'm thinking, yeah, I don't want to, it's not worth it on that one.
Sure.
I'm just going to start over and plan a new experiment and level up. And it hurts my heart. And there's a very specific sound when glass gets thrown into the garbage can and it all hits each other. And I hate that sound, but I'm just going to do it. Bite the bullet, start over. And sometimes that happens in hobbies.
Yeah.
But sometimes we melt them down.
Yeah. Yeah. But when think of it, maybe we'll pick this conversation up in a future episode, like how powerful it would be to have communities in healthcare where hospitals were sharing their mistakes and failures with others so they could learn. There's not a lot of that in healthcare, or maybe you almost say none of it, at least formally, the way you have that in aviation, for example. That culture of reporting and non-punitive reporting.
Non-punitive, Maybe we need to start building something like that in healthcare. So take it a level higher.
There's a group, and I encourage the listener and Grace, you might want to look. There is a group really trying to advocate for and pushing legislation to create, modeled on the National Transportation Safety Administration, a National Patient Safety Administration. Something worth checking into. And right now it's still in the proposal and possibilities stage, but I think it would be powerful. Not to create a bureaucracy, but to create learning and sharing and improvement.
So I think the National Transportation, they're the ones that say for this road, it's safe to go this speed. Here's the speed limits. They do a lot of mistake proofing, a lot of safety. I just think that could be amazing if it's not bureaucracy, but it's actually very improvement oriented.
Yes. And NHTSA will come in and do independent investigations, and they have the legal right and ability to do that, where it's not the same in healthcare.
Healthcare started as a cottage industry, and then we had the whole television of the 50s, Marcus Welby, MD, and we put docs on a pedestal, and we gave them quite the ego. We haven't found a way to hold them accountable.
Mhm.
Literally, I started in healthcare. I worked in an emergency room and I was told, you don't ask the doctor any questions. They say jump, you just jump. Don't ask how high, why, or where. Just do it. That needs to change.
Yeah. Well,
It's going to be a
it's
journey.
we'll be optimistic, and the thing that keeps me going is knowing that it changes in some locales, but it takes 17 years, if longer, sometimes for these things to spread as well. So, well, I want to
It's
thank,
a calling.
yeah, and I'm glad you share that calling. You came at it from kind of medical clinical into engineering. I came at from engineering, not into clinical, but into working with and
Healthcare.
supporting clinicians. And I know you're a laboratory professional, right?
Yes.
I,
We
when
learn
I
it from day one.
and when I work with labs, I'm not there to dig into the technical clinical details of things, but we can collaborate and work together and make sure we're improving processes and flow and reducing delays in a way that has the checks and balances of course, we don't want to jeopardize the quality and the accuracy of the test results.
Right.
So we
And
work together.
that's the thing about the lab. It's quality first and it's massive verification and but in a good way and not overdone.
Mhm.
This is how much verification is needed. This will be done. It's documented. You move on. And it's a great foundation for industrial engineering and any quality improvement. Labs are very strict.
Yeah. Well, again, I want to thank Grace Bourke for joining us today. We are in a lot of ways birds of a feather. You had so many powerful things to say. I was trying to. I was making the mistake earlier in the episode of maybe jumping in too much because you prompted so many great thoughts. But you have great things to share, and I want to thank you for being here to do so today. And again, I hope in the future.
It's been a pleasure, and I hope to talk to you again soon.